Warning: 12 weird signs that show you're having prostate cancer. Prostate cancer is one of the most prevalent and dangerous cancers affecting men today. According to the American Cancer Society, prostate cancer is the second most common cancer in American men after skin cancer. It's estimated that 1 in 9 men will be diagnosed with prostate cancer in their lifetime. In 2022 alone, over 200,000 new cases of prostate cancer are expected to be diagnosed. While prostate cancer starts small and grows slowly in some men, in others it can grow and spread quickly. That's why it's so important to understand the early signs and symptoms so you can detect it before it spreads. In today's video, I'll walk you through 12 weird signs that may indicate you have prostate cancer brewing under the surface. Recognizing these subtle clues early is pivotal, since prostate cancer is very treatable when caught early. Weak or interrupted urine flow. One of the classic signs of a prostate tumor is weak urine flow, straining to urinate, or an intermittent stop and start stream. As the prostate enlarges from a growing tumor, it clamps down on the urethra like a slowly tightening fist. This impedes and ultimately blocks the free flow of urine through the narrowed urethra. Men describe their stream as merely dribbling out, taking forever to fully empty the bladder. Or the flow may sputter on and off instead of a smooth, continuous outpour. Left untreated, complete urinary retention can occur, where no urine can be passed at all. Frequent urination, especially at night. Frequent daytime peeing and nighttime bathroom trips, called nocturia, occur as the bladder must work harder to overcome obstruction from the enlarged prostate pressing on the urethra. To push urine through the narrowed urethral canal, the bladder muscle contracts extra forcefully and squeezes excessively, causing a persistent urge to urinate. The excess residual urine left behind after each incomplete void then quickly fills the bladder again soon after. Nocturia is especially characteristic, as people may get up to pee 5 or more times a night. Their sleep is constantly disrupted, leaving them exhausted. Sudden onset frequent urination without infection should prompt evaluation for prostate issues. Blood in urine or semen. Blood in the urine or semen can signal the presence of a prostate tumor. However, enlarged prostate alone doesn't typically cause blood, and underlying cancer is more likely the source of bleeding. Tumors eat into capillaries and damage tissue, releasing blood. The blood may visibly discolor urine pink, red, or brown. Microscopic blood invisible to the eye is found via urinalysis. Blood in semen, typically seen as a pinkish or rusty discoloration, also warrants evaluation for potential prostate cancer. Semen passes through the prostate gland, allowing tumors there to taint it with blood. Don't assume prostate bleeding is from a harmless enlarged prostate or infection without ruling out cancer. Erectile dysfunction. Difficulty achieving or sustaining erections may be an early pointer to prostate cancer. Tumors can invade the nerves and block blood flow required for functional erections before they appreciably enlarge the gland itself. The nerves controlling erections run in a neurovascular bundle directly alongside the prostate, making them vulnerable to compression or damage from even small tumors in the gland. Men may start noticing a trend of incomplete erections during foreplay or intercourse, with difficulty attaining a sustainable, firm erection, sufficient for penetration. Erections may come inconsistently or seem to lack their usual vigor and fullness. As the tumor enlarges, erections weaken progressively and eventually cease altogether as nerve signals are obstructed. Don't simply dismiss new-onset erectile problems as just getting older. Bring them to your doctor's attention for evaluation of possible underlying prostate issues. Painful ejaculation. Discomfort or stinging pain upon ejaculation is an underrecognized sign of potential prostate cancer, especially when it develops suddenly. Normally, semen should flow through the prostate gland and out of the urethra without pain. But prostate tumors may partially obstruct or irritate the gland, causing painful spasms as semen passes through. Men describe a burning or sharp piercing sensation when ejaculating. In some cases, pain is also felt in the testicles, urethra, or rectum during climax as prostate tissues constrict abnormally. The pain may last for an hour or more after sex. If ejaculation has suddenly become uncomfortable when it never was before, see your doctor promptly to assess for obstruction from an enlarged prostate or prostate cancer. Don't neglect new, unexplained sexual pain. Lower back pain or hip pain. Unexplained backaches that seem to be centered in the lower spine or pelvic region can betray prostate cancer effects on nearby structures. As tumors enlarge, they can invade and compress nerves emanating from the lower spine into the pelvis that orchestrate pelvic sensations and function. This pinched nerve irritation produces vague, deep aching pain in the lower back, buttocks, or upper thighs. Prostate cancer may also metastasize to the lumbar spine bones, producing pain from cancer eating away at vertebrae. Blood and stool. Bowel movements may become tinged with blood when a sizable prostate tumor presses on or eats into the rectum. The prostate gland sits immediately in front of the rectum, separated only by a thin tissue wall. As prostate tumors become large or aggressive enough, they can erode through the tissue, separating the rectum and prostate, puncturing blood vessels, and releasing blood into the stool. Stools may appear maroon, tarry black, or bright red from active bleeding as the tumor ulcerates into the rectum. More subtle internal bleeding from smaller tumors higher up in the colon can also manifest as apparent constipation with ribbon-like stools. Any new-onset rectal bleeding or black stools must be promptly medically evaluated and not assumed to be from hemorrhoids. Pelvic pain or discomfort. A prostate tumor expanding near nerves and muscles of the pelvic floor may cause vague sensations of pain, pressure, fullness, numbness, or tingling in the pelvis, buttocks, genitals, or inner thighs. As the prostate enlarges, it compresses the urethra, rectum, bladder, and internal reproductive structures, all confined within the rigid bony pelvis and lower abdomen. This crowding and displacement of pelvic organs by the tumor creates nonspecific pelvic heaviness and soreness. Tumors also irritate regional nerves controlling pelvic muscle and organ function as they push against nerve fibers. Pelvic nerves are very sensitive. Any irritation or inflammation from a tumor causes uncomfortable sensations, which should prompt medical evaluation. Loss of bladder control. Trouble controlling the release of urine or leaking urine, called urinary incontinence, develops when prostate tumors obstruct urinary flow and prevent the bladder from fully emptying. Residual urine left behind after incomplete voiding then leaks out when pressure rebuilds, causing dribbling or a sudden, urgent need to urinate. Tumors also weaken the bladder's sphincter muscle, which controls urine release, as they infiltrate and compress local tissues. Neurological signals coordinating bladder function get disrupted as well. Men may complain of leaking urine when coughing, laughing, or lifting heavy items that increase intra-abdominal pressure and overcome the weakened sphincter. Nighttime bedwetting and uncontrolled daytime urination also occur as the tumor interferes with normal neurological control of bladder function. Leg swelling. Swelling, heaviness, and edema in the lower legs can indicate blockage of drainage veins or lymph vessels by prostate cancer metastatic to pelvic lymph nodes. Pelvic lymph nodes lie in close proximity to the prostate gland and are among the first sites prostate cancer spreads to. Enlarged cancerous nodes then compress veins and lymphatic vessels, returning fluid from the extremities, impeding normal drainage, and causing fluid backlog and swelling in the lower legs. Fatigue. Unrelenting, profound fatigue out of proportion to activity level can reflect the effects of prostate cancer on the body before diagnosis. This cancer-related exhaustion has many sources. Chronic blood loss into the urine from tumors slowly saps iron levels over time. Declining testosterone from impaired prostate function reduces energy. Cancer-related inflammation releases chemicals that alter metabolism, and inadequate nutrition from suppressed appetite or absorption wastes reserves. Additionally, the body works harder to compensate but ultimately has little reserve left. Bone pain. Prostate cancers often spread, or metastasize, to the bones, and this deposit of cancer cells produces intense pain where they infiltrate the skeleton. The lower spine, pelvis, hips, and upper thigh bones are frequent sites of painful metastases that produce an aching, throbbing sensation. Bone metastases indicate an advanced disease that is no longer confined to the prostate gland itself. But modern treatments can still relieve pain and extend life for years by targeting cancer cells in bones and throughout the body. 6 ways to prevent and heal prostate cancer. Catching prostate cancer early is pivotal, since treatment is more effective before it spreads. While prostate cancer can't be fully prevented, adopting certain healthy habits may lower your risk of developing or dying from this disease. Here are 6 key ways to protect your prostate health in the long run. Get screened regularly. Participate in prostate cancer screening so any cancer can be identified in the early, curable stages before causing symptoms. Current guidelines recommend all men have a discussion with their doctor about screening with a PSA blood test and digital rectal exam starting around age 50, or age 40 to 45 for higher-risk men. Those at high risk due to family history may benefit from screening even earlier. Screening finds potentially lethal cancers while they are still small and confined to the prostate gland, improving the odds of a cure. Maintain a healthy body weight. Being significantly overweight or obese increases the risk of developing more aggressive prostate cancer, which is more likely to recur after initial treatment. Belly fat, in particular, is linked with worse outcomes. Excess body fat boosts estrogen production, inflammation, and insulin resistance, all of which may fuel prostate cancer growth. Losing excess weight through diet and exercise gives you the best chance of a cure. Eat smart. Choosing a heart-healthy diet rich in veggies, fruits, whole grains, nuts, legumes, fish, and healthy oils may help protect the prostate. Limit red and processed meats, which appear to stimulate cancer-related hormones. Insufficient vitamin D and excess calcium also correlate with more aggressive disease. Anti-inflammatory foods, green tea, and lycopene-rich tomatoes are especially beneficial. Dairy in moderation may be protective. A nutritionist can provide guidance. Stay active. Engage in at least 2.5 hours of moderate-intensity exercise weekly, or 75 minutes of vigorous exercise. Physically active men have a lower risk of dying from prostate cancer. Aerobic activity also wards off obesity, controls cholesterol, stabilizes glucose, and boosts the immune system, all bonuses when battling cancer. Strength training preserves needed muscle mass. Walking briskly, swimming, cycling, and jogging are great low-impact cardio options. Avoid smoking. Smokers face double the risk of lethal prostate cancer recurring after treatment compared to non-smokers. Smoking also promotes the spread of prostate cancer to the bones. Tobacco chemicals appear to reprogram prostate cells towards uncontrolled growth while also suppressing immune function. Kicking the habit provides significant benefits to overall health and cancer survival. Manage stress. Finding healthy ways to manage life stress may positively influence prostate health. Some research correlates high anxiety, depression, social isolation, and inadequate coping methods with greater prostate cancer risk and progression. Stress management techniques like meditation, yoga, journaling, and cognitive behavioral therapy can relieve anxiety and depression while boosting resilience. Support groups connect cancer patients with resources. A counselor can help identify constructive stress outlets. Conclusion: staying vigilant for subtle body changes and discussing any new or persistent symptoms with your doctor gives you the best chance of detecting prostate cancer early. Screening, when appropriate, also permits early diagnosis before warning signs appear. Don't ignore your prostate health. Eating right, staying active, managing stress, and getting checked offer your prostate the best odds against cancer. Please like and subscribe if you found this information helpful. Together, we are winning health.